So, good question. Most people don't know what plastic surgery is. You'll see a bunch of bozos in my comments all the time saying, what would you know? All you do is implants, and they don't understand what a plastic surgeon does. So just to review, plastic surgeons do at least 6 years of training. I did 8. I'm also a fully trained general surgeon. So we are not people who only do breast augmentations. We do a lot of big bad surgery, and here's just a review of some of the things plastic surgeons are trained to do. So let's start with cosmetic surgery because everybody knows that's what we do. Yes, cosmetic surgery is part of plastic surgery. Plastic surgeons also do burn surgery, both acute burn care as well as burn reconstruction. We also do hand surgery, which is an area a lot of people don't know we work in, so we're all trained in hand surgery. And then also plastic surgeons are reconstructors, and so we fix problems that are caused by trauma or cancer. So if you have a piece of your body removed because of a cancer surgery, we're the ones that are called on to fix it. And if you are someone who had a trauma and had some serious damage, we are the ones that are called on to fix that. So it could be facial trauma, it could be hand trauma that we fix, but also trauma all over the body. Same thing for cancer reconstruction. Now, because we are reconstructors and fixers of problems, this is why plastic surgeons are experts in microsurgery. So all of us in our residencies are trained in microsurgery, where we do flap procedures. You may have heard of the term free flap, where we take tissue from one area of the body, move it somewhere new, sew tiny blood vessels together under a microscope, and allow that tissue to live somewhere new. So that is a form of reconstruction that plastic surgeons do. And then finally, I'll throw in there all of the pediatric plastic surgery that plastic surgeons do. So we are the ones that fix cleft lip and palates, congenital hand deformities, synostosis. We do all kinds of things with pediatric patients as well. So it's a very broad field, but really the heart of plastic surgery is fixing problems. And we fix problems not only for cosmesis, but for structure and function. So all of these things are very important, and it allows us to be the best at cosmetic surgery, right? Because we are looking at problems the way they should be looked at, not just how things look, but how they function.